Hi, dementia caregivers. Today I want to talk about what exactly is dementia and what kind of symptoms can you expect to see. So dementia is actually a collection of symptoms. It's not an actual disease itself. It's a collection of symptoms that can be caused by many diseases. Some examples of diseases or injuries that can cause dementia symptoms are Parkinson's disease, Alzheimer's disease, multiple sclerosis, Down syndrome, traumatic brain injury, vascular disease, and of course, dementia with Lewy bodies. And there are many others as well. The symptoms of dementia vary from person to person, but ultimately they have an impact on that person's ability to perform daily activities. And this is one of the ways that we distinguish dementia from just typical aging, is that impact on daily activities and the ability of the person to do those things independently. The most common symptom, as most people know, is short-term memory loss, but there are other symptoms that impact function as well, including loss of the ability to understand where your body is in space. This is a sense called proprioception, and it affects the ability to walk and particularly balance. There are also other cognitive changes like understanding verbal communication and speech, swallowing changes, difficulty not with vision itself, but interpreting visual input, so processing that in the brain. So of course, most people know about the short-term memory loss, but a lot of the other symptoms are not well related, particularly when you get a dementia diagnosis. And so these things aren't necessarily passed on, and you don't hear a lot about them besides the short-term memory loss. But these other symptoms can cause a great deal of frustration and difficulty for individuals with dementia as well as their caregivers. Of course, it's important to understand that dementia manifests or kind of shows up into each individual person a little bit differently. So not everyone may have all of the symptoms that can come along with dementia. And of course, it will progress at different rates in different people. So here are a few examples of the types of changes that can come with a dementia diagnosis. As symptoms progress, you may see a variety of cognitive changes, including difficulty with verbal communication, both finding words and then understanding what other people are saying. Also difficulty with complex tasks, such as driving, or driving to a new location, wayfinding, if you will. Cooking is a complex task and becomes very difficult for a lot of individuals with dementia because it's a multi-step process. And it can, in the later stages, even expand into bathing and dressing. Sometimes people with dementia lose the ability to recognize familiar items, and sometimes they lose the ability to know what to do with them. So for example, they may see shampoo and conditioner and soap in the shower, but not be able to distinguish which is which or what they're supposed to do with each individual product. Typically with dementia, you see a decreased ability to interact socially, and that comes a lot from the communication aspect, the loss of that ability to understand verbal communication, but also individuals may lose the ability to recognize familiar faces, recall names of familiar people, and oftentimes these symptoms lead to social withdrawal, which can cause depression and loneliness. Aside from the cognitive changes of dementia, there are also behavioral changes. You may see mood swings, again, depression or anxiety, an increased tendency towards agitation, easily frustrated, easily confused. Many individuals with dementia develop poor judgment, the inability to determine when something is safe or unsafe. Other changes in behavior include lashing out in anger when they become frustrated, repetitive questioning, and wandering. And of course, there are physical changes that come along with the dementia progression as well, including changes in gait, in other words, how the person walks. Typically, these are related to changes in balance. And also there can be changes or difficulty with swallowing. The good news is that there are scientific evidence-based practices that can be incorporated into caregiving that can help to manage all of these symptoms, both for the patient with dementia and to make caregiving easier. The tricky part is that a lot of these strategies that you would use aren't necessarily intuitive. They're not necessarily the way that you would act in a situation if you were interacting with someone who did not have dementia. And so again, that's the tricky part in learning these new caregiving strategies, is that it's typically not the way you kind of want to react or lean into a situation. So it requires a little bit of practice and a whole lot of learning to kind of change the way that you think and approach the situation with the person with dementia. I encourage you to take a look at some of my other videos that talk about specific scenarios and how to work with those so that you can begin to kind of shift your mindset and employ some of these strategies. Meet the person with dementia where they are, where their abilities are right now today. Try some of these other strategies that I offer in some of the other videos on my channel and see if you are able to implement a change in the way that you approach the situation that will make it a lot easier for you in your caregiving journey and a lot easier for the person with dementia to be more cooperative, more relaxed, more calm, and less agitated. I invite you to subscribe so that you don't miss a single video. Thanks for watching today. See you next time.